So thank you, Mr. Chairman, Board of Supervisors, for inviting me back to speak to the board. I apologize that I have to give this taped message as I am on shift in the emergency department tomorrow in Petaluma. Since I last spoke, we have seen a constant but steady decline in our numbers of new COVID-19 infections, very encouraging. It appears that this virus runs in cycles, and the decline in our numbers is consistent with what other counties and states, countries are seeing. The cycles tend to be every 2 to 3 months. It's poorly understood why it runs this way. Just as fast as the infection goes up, after 8 to 12 weeks, we see the infection rate start to decline and it comes back down as fast as it started. We have seen this phenomena across the world. Probably the first time we saw it was in India. Unfortunately, in India and in many other places across the world, when we saw the decline didn't come down to the same low baseline from which it started. So in May of this year, we reached our low point in the COVID-19 pandemic with 3 per 100,000 infections. Currently, we were at about 38 per 100,000. We peaked in early August at around 70. 38 per 100,000 is still dangerously high with lots of circulating virus in our community, but it's much better than 70. We need to see these numbers continue to decline as we move into the winter and into the holidays. This is important because we do expect with people moving indoors and as the temperatures begin to drop, that we will have more transmission within the community. We are seeing this in the state of Alaska right now, where infection rates are over 150 per 100,000, twice what we were at our peak. It is good news that we are seeing a drop in our new cases, but we must not let our guard down again as we did last spring. Since July 1, 2021, we have lost 100,000 people in this country. In Lake County, we've lost 29. Each of these people have families with mothers, fathers, grandpas, grandmas, children. And the current statistics show that many of these people who died were much younger than those who died in the beginning of the pandemic. To those families who are grieving, please accept my greatest sympathy and condolences. The process of dying from COVID-19 is a horrible experience. The isolation, the aloneness that the patient feels and that the family feels. And, I see it every day in my work, and my heart goes out to you families that have experienced that. We see regularly in the media people who speak out to get vaccinated after they have been stricken by COVID-19. In Sunday's Press Democrat, there was a rather poignant article and a plea from a Tennessee police officer who had COVID-19. He wrote from his hospital bed and a text to his police chief, quote, "When I can't take 3 steps to get to the potty chair and I feel like a grizzly bear just choked me out, that's gotta be the worst feeling in the world. You have got to tell people to get their shots." Unfortunately, this policeman, father of 5 children, married, died 2 days later. He was not vaccinated. So vaccinations are our ticket to getting out of this pandemic. And let's talk about vaccination. This is some good news. Between September 1 and September 25th, we were able to give 2,700 vaccines in Lake County. This is more than 100 a day, which is an increased rate of vaccination from last month. An additional 600 people are fully vaccinated and an additional 600 people are partially vaccinated. Currently, about 60% of those eligible for vaccine are vaccinated in Lake County, compared with 70% statewide. Statewide, 22% of those eligible have received no vaccine, and in Lake County, it's about 32%. We are doing better and we still have opportunities. So I want to speak about the jail outbreak, just to update you. I think this is another success. We peaked out with 83 cases, 11 staff and 72 inmates. Currently, there's only one active case, a staff member. I think if we can get that staff member better and be excessively cautious, we might have worked our way out of this outbreak. And congratulations to all of you who worked hard to do that. I wanted to speak a little bit about how the hospitals are doing. Hospitals are still struggling to staff. Beds are in short supply. This morning at 9 o'clock, there were 3 ICU beds available in Mendocino and Lake County combined. That's very, very few considering the large population. And I think that's true throughout much of Sonoma County as well. In my work as an emergency physician, I constantly struggle to place people in the hospital, sometimes waiting up to 24 hours to transfer them as far as 200 or 300 miles away. So it's we're still struggling with bed availability. Many of you are aware that the Pfizer vaccine has a booster recommended. I wanted to talk about that. On September 24th, the CDC director, Rochelle Walensky, stated that we can best serve the nation's public health needs by providing booster doses for the elderly and those in long-term care facilities, people with underlying medical conditions, and to adults at high risk of disease from occupational or institutional exposure. This aligns with the FDA's booster authorization and makes these groups eligible for a booster shot. On the same day, the Advisory Committee on Immunizations also announced that it had only reviewed the Pfizer-BioNTech vaccine, and they will address with the same sense of urgency, the Johnson & Johnson and Moderna vaccines. So, and that'll probably happen by the end of this month. So what this recommendation means is that people 65 years and older and residents in long-term care settings should receive a booster shot if they receive their primary series of Pfizer. And that series should have been completed 6 months ago. So it's recommended 6 months after. People age 50 to 64 with underlying medical conditions should also receive this booster. And people aged 18 to 49 may receive the booster based on their individual benefits and risks as reviewed with their primary care physician. People aged 18 to 64 who are at increased risk of COVID-19 exposure and transmission because of occupational or institutional setting may receive a booster of the Pfizer-BioNTech vaccine. I've been questioned by numerous people who got the Moderna vaccine if they should get a Pfizer booster. And I think the answer to that question is no. Be patient and wait for the data on the Moderna to come out, which should be out by the end of the month. And there is some evidence to suggest that the Moderna vaccine actually gives longer lasting protection than the Pfizer vaccine. And the data on the Johnson & Johnson will also follow shortly. Also in the news, on Saturday, the governor announced a mandate for vaccine for all students of schools in the state of California. This mandate follows the same mandate for all other vaccines such as measles, mumps, polio, rubella, diphtheria, pertussis, tetanus. So what this means is that we are the first state to mandate the vaccine for COVID-19, and it's likely that other states will follow suit in the coming weeks. This may be in effect as early as January of 2022. Wanted to speak about how schools are doing. We have had numerous cases in our schools in Lake County of COVID-19 infection. Fortunately, because of the masking mandate and because of California's higher vaccination rates, we have not had to close many schools. Nationally, there's been 2,000 schools that have closed. In the state of California, only 12 have closed, and we've had none close in Lake County. I think we should give ourselves a pat on the back for this, and I think it's due to the masking mandate, the vaccinations, the attention to proper hygiene, and the hard work of the staff and those districts serving our kids. The state of California also has a modified quarantine to keep children in school when they've been exposed to an active case. And the way this works is that when an unvaccinated student is exposed to an active case, they can still come to school if they are asymptomatic, they are tested twice weekly, they wear the proper mask, and they continue to quarantine for all extracurricular activities. We've been doing this in Lake County, and it seems to be working. We're not seeing an increased rate of infection, which is good news. Some other information in the news is regard to a new drug that Merck has asked for emergency approval. And that drug is an oral medication. We don't have any oral medications currently. We have remdesivir, which is an IV medication. It's thought that this drug would reduce mortality by 50% and decrease hospitalization. I don't know anything more about it yet, and I'm sure those studies will be released soon. But again, it's hopeful information, and there are other drug companies that also have drugs in the pipeline to treat this disease. So that's encouraging news. So as we muddle through our way through this pandemic, the one item we can count on, I think, is change. Everything changes with new data. And we don't know where we're going exactly or how we're going to get to the end of this. But the information we currently have certainly does help us reduce and manage our risk. We've talked about masking and the importance of proper masking and quality masking in terms of seal with N95 masks. And I think as we move into the winter months, and we probably will see another surge, and if indeed we do, I think it's all the more important that we be fully vaccinated. I think that the Delta virus is out there and active in the community. It's clear that the Delta virus, that if you're not vaccinated, it will find you and it will eventually infect you. It's a much easier way. There is a much easier way to get your antibodies than through infection, and that is through vaccination. The Delta virus will make you sick, and many will become critically ill, and some will die. With regard to the vaccine, you'll get some myalgias, you might have some chills, you might get a sore arm, but you won't become critically ill, and you won't die. I think we are very fortunate in this country to have these resources available to us. I know there's a lot of discussion and acrimony over vaccinations. I encourage you all to discuss this with your family members who have not been vaccinated to mitigate their risk, to mitigate your risk, and to help all of you in your extended family. Lastly, I wanted to put in a plug for the flu vaccine. The flu vaccine is now available. It can be given with the COVID vaccine. It's available in pharmacies, and all the hospital staffs are beginning to vaccinate their people with it. I encourage you to talk to your primary care physician and ask when the best time is for you to get your flu vaccine. So once again, I want to thank you for inviting me to speak to you today, and I hope I see you on a live Zoom call in a couple of weeks, so I'll be able to answer any questions. Thank you.